Hi, I'm Dr. Douglas Ripley of Abundant Life Chiropractic. I'm going to give you some insight as to what we do in chiropractic. I am a chiropractor, and what I do is I look towards the spine for the cause of disease. Thomas Edison once said the doctor of the future will look towards the spine for the cause of disease and interest his patients in care of the human frame, diet, and exercise. There's 24 vertebrae in our spine. There's 31 pairs of nerves that go to every muscle, every organ, and every tissue in the body. Here's a gentleman on this picture here who's laying on a couch. He's in a bad position. There's a normal curve in the neck here, a normal curve in the back, and the low back. Here, he's compromising the curve in his neck because his head is positioned forward. He's sitting on a couch that gives no support to his thoracic or lumbar spine. He's going to wake up in the morning with neck pain and possibly a pinched nerve and numbness and tingling maybe in his arms. He may even have low back pain. Here's a situation where there's an auto accident. The physical trauma that takes place in life, slips, traumas, falls, auto accidents, damage takes place. We might not always feel the symptoms right away, but a few weeks, a few months, a few years later, the damage that's done in that insult, that trauma, shows up. Here's a woman that's experiencing the stress of her job. She's got a headache. She's rubbing her temples. That's emotional stress. So we have physical stress. We have emotional stress. Emotional stress causes muscle tension. It causes all sorts of things that take place in the body. Here we have a picture of a sunset in an area, an industrial area where there's lots of pollution. Chemical effects can cause imbalances in our body, in our nervous system, from drugs, from alcohol, from the foods that we eat, the chemical toxins that get in our body. All of these have an effect on our body. So there's physical stress, there's emotional stress, there's chemical stress in the body. Back to the spine. 24 vertebrae, 31 pairs of nerves. They go to everything in your body. If you don't believe your nervous system goes everywhere in your body, then take a pin and stick it in your body anywhere, and I guarantee you'll feel it. The brain sends those impulses down through a cable about the thickness of your pinky. It goes down through a canal in the vertebrae, the spinal canal, and then each one of those nerve tracts, they exit at different points in the spine. For example, I live in New Jersey. We have a main artery in New Jersey called the New Jersey Turnpike. It goes from North Jersey to South Jersey, much like it's the Garden State Parkway, much like a turnpike. There's many exits off from North Jersey all the way to South Jersey. Same thing with the spine. In the neck, C5 and 6 always goes to the throat. For example, driving down the parkway, those in New Jersey may know that exit, say 124, is the bridge at Amboy. As you come down, exit 98 is Point Pleasant. As you come down, exit 82 is Toms River, and so on and so forth. The body's the same way. C5 and 6 always goes to the throat, mucous membranes, the palate. As we go down, T1, T2 always goes to the heart, and to the lungs, and to the bronchi. T4 always goes to the gallbladder. T5, 6, 7 always go to the stomach, and so on. And you can do this all the way on down. L1, L2, they go to the colon and the large intestine. S1, 2, 3, and 4 down here to the prostate, reproductive areas. So your whole body is affected by your nervous system. Those areas come out here, and then over here there's various symptoms, from headaches to sore throats to sinus problems to pains in your arms, pains in your back, pains in your legs, asthma, allergies, upper respiratory tract infection, indigestion, gas, constipation, sciatic pains, low back pain, and on and on and on. My job as a chiropractor is to try to find if any of these bones have become misaligned. That terminology is called subluxation. Much like a dislocated shoulder or hip, which is very painful, a subluxation is a misalignment within its joint space, and it doesn't have to be painful. Eventually they do become painful. Eventually they irritate the nerves and the discs and the surrounding muscles and tissues. My job is to find where they exist and determine whether or not they can be corrected, whether or not fluid motion can be put back in the spine. We do that through a gentle but effective chiropractic adjustment. Chiro means hands practice, hands-on. However, we use lots of other things. We have tools such as an activator. This tool here can set a bone in motion. I can set this at any tension, a strong tension for the low back or lower for the cervical spine. So there's lots of things we do. But my job, find these misalignments, determine whether or not they can be corrected, and then put a patient on a corrective program to make changes that will be long-lasting and eventually prevent future degenerative arthritis from settling in.